Okay, we're gonna try again with our automation notes. I've been rushing so much to get these videos put out for the first week that I didn't realize how much of a mistake I had made in making this video. I already had a small error at the beginning of the vision notes as well, which hopefully that one is not so serious to cause any confusion. But for this previous one, for the automation one, well, that was all a big mess. So we're gonna try again here. And so automation, following up on the topic of errors and safety. And so the issue here for why we're going to talk about automation at this point is at the end of the errors and safety notes, we talked about what we call exclusion design, which is a way of sort of designing errors out of a system, which is involving maybe just taking away certain steps. But another way to do it is to automate certain steps, right? And so that way, if a human has a tendency to, or at least a likelihood of making an error in a given situation, is it possible that we can automate this process so that the human doesn't even have to perform this particular task anymore? And if the task can be automated, maybe we can eliminate error, or at the least, we can eliminate human error. We might be faced with other kinds of errors that arise due to automation. And this is why we need to talk about this now. Because there's lots of issues when it comes to using automation that we need to be concerned about, which is what can it do and what can it not do? And will people be willing to use it is kind of another issue here as well. So when it comes to what we might think of as adopting automation, people have differing perspectives on this. And since this is a class that deals with the human perception of technology, then that's related to human factors as well. This is related to what's called technology acceptance, right? And there's a whole theory called the technology acceptance model. And we need to be concerned with whether or not any kind of technology, whether it's something that we might call automation or whether it's any other kind of new technology, we want to understand how people perceive it and understand it and how that affects their use of it, right? And of course, understanding human users of technology, well, that's the entire theme of this class anyway. So, well, let's start with a definition here. So this one comes from some big names in human factors here. Raja Parasuraman, Sheridan, a big name in virtual reality research, Chris Wiggins, well, Sheridan, I won't necessarily say virtual reality research, but had some important ideas on the concept of presence, which we talked about a little bit in the methods in notes in terms of the VR-based work in the presence and immersion. So we have this definition here is full or partial replacement of a function or task previously carried out by the human operator here. So that means we have levels of automation, which I'll show you in a second. But first question we also want to ask, our second question, besides the definition, is why would we automate? And so I've already kind of hinted at this, right? So eliminating human error. And that's our second in the list here. So let's first consider the first one. There are some tasks that are simply just too dangerous for people to do. And well, even in certain cases, people have done these dangerous tasks in the past, but people have been hurt. And it's not necessarily because of error, but simply just because the task is inherently dangerous. And so can we just automate this and eliminate that danger? Some examples that come to mind, maybe I don't know why I'm imagining something like a bomb squad, right? But the idea is that if you're going to send in someone to inspect and maybe try to even defuse a bomb, putting a live human in that position is clearly very dangerous. But can we automate this in some regard? And so how would we do that? Well, we don't necessarily have robots that can totally autonomously defuse a bomb, but we can certainly at least use a teleoperated vehicle, right? So teleoperation is a fancy way of saying remote control, right? And that involves things like unmanned aerial vehicles, AKA drones, right? That's a form of teleoperation that is in a hazardous environment as well, because if those are used in combat scenarios, then instead of sending planes with human pilots in them, you send drones, and that minimizes risk to your human pilots. There are also the unmanned ground vehicles, right? And this is the sort of thing that you might use in say, a bomb scenario. Also searching for people in rubble, right? That's dangerous if a building collapses and you need to see if there's people inside and see if you can find them and rescue them. Certainly danger is an issue, but also a possibility, right? So this means that they're very small, cramped spaces. So small, you can imagine like insect-sized robots with cameras that can be used to explore a collapsed building and find survivors, right? That's kind of a very interesting use of technology here. I also list mathematical computations as well, because the idea is that the ability to use supercomputers to crank out difficult calculations on large data sets are things that simply just weren't within the realm of human possibility up until just a few, the last couple of decades. So certainly a lot of advances in mathematical modeling have been made available because of more powerful computers. So as I mentioned before, though, eliminating human error is one of our major concerns here. So that's our second point, right? And so in any situation where a human might be likely to make mistakes or sometimes fatigue, because when we do a task for a very long period of time, we might be likely to become fatigued, and that fatigue increases error, right? So one example is assembly line manufacturing. So a lot of times when assembly line manufacturing was first created, we think of like Ford Motor Company and that sort of stuff. Assembling cars involved having a person perform a very repetitive process so that the assembly comes down the line and one human worker performs one particular task to assemble the parts together, and then it moves down to the next person who does another task. So each person on the assembly line performs the same task over and over and over again all day long. And certainly you would think that this kind of repetition and practice would make someone become something of an expert at doing that one task, which certainly is true. But the fatigue and repetition of it causes people to have mind wandering, lapses, and so forth. And that can then increase errors. So machines, computers, and robotic arms and so forth are really good at doing repetitive tasks over and over and over again in the exact same way, right? If you program a robotic arm to perform a specific movement, it will do exactly what you tell it to do, right? And it can do that with no variability over and over and over again. When humans perform movements, there's a lot of variability in our movements, right? The way in which we make just a reach to pick up an object can be highly variable time after time after time. But a robotic arm that's been pre-programmed to execute a certain movement will exhibit extremely little to no variability in how it performs these actions. And so this kind of high level of reliability, right, of being able to do the exact same thing every time without variation is an important part of preventing errors, assuming you've programmed it correctly. So that's the issue that I mentioned at the beginning, is that if automation could eliminate human error, but it might bring about new errors. And so we might have actually new kinds of human errors. So assuming I have poorly designed and programmed my robotic arm, it will do exactly what I've told it to do. So it doesn't make a mistake, but because perhaps I've made a mistake in programming it, now it's going to still do the wrong thing. And that's an error that perhaps lies now still on the human side because of the mistake someone makes in programming it and telling it what to do. But there's another kind of mistake that we might also think about here, which is I just said that when humans perform certain actions, there's a lot of variability. And that variability is actually important in human behavior because that's what gives us flexibility and adaptability. And we can adapt to dynamic environments, right? So if I'm trying to operate some kind of system and maybe based on some information I have, like temperature and weather and stuff like that, that I might need to change how I do certain things, right? Like imagine I'm operating a remote remotely operated unmanned ground vehicle, and it's rolling along, and it encounters some wet mud, and this may affect its traction. And I may have, based on experience, realized that I should uh, slow down a little bit so that I don't lose control of the vehicle. So this ability to be adaptable and flexible and change how we do things based on context and circumstance is a characteristic of human intelligence. Now, can automation do that? And the answer is, well, yes, it can, but that's only a relatively recent advance. So classically, a lot of systems would simply just, if you automated this vehicle to just go forward, it would simply just go forward, right? And when it encountered resistance or loss of traction, it might just spin its wheels and it wouldn't know any better. It's just doing what you told it to do, which is to roll its wheels to go in a certain direction, and it can't adapt at all. All right. So we would say the machine is a little bit dumb in the sense of saying that it doesn't have knowledge of what it's doing and why it's doing it. And when it encounters problems, it simply just does exactly what you tell it to do, no more and no less. And so that's what I mean by the difference between sort of a dumb machine versus an intelligent human. But nowadays we have the ability to incorporate these kinds of contextual factors into automation. So if a machine detects, for example, loss of traction, and we can detect that, then it could be programmed to automatically perform a reaction to that, to change maybe the power that goes to different wheels or axles on its whatever it uses for locomotion. And in that case, then it could adapt to loss of traction in a way that's fairly automatic. And again, it can be slightly more intelligent because it is now somewhat adaptive. Likewise, of course, we now have artificial intelligence and we have machine learning algorithms. And the concept of machine learning is that, that's the definition, again, of human intelligence. Learning is a way of talking about adapting to dynamic and changing circumstances. We learn that in certain situations, we may have to perform actions and make decisions differently than we otherwise would. And computer programs historically would simply be fixed, and you just execute this code and do whatever you say to do. But machine learning algorithms, by contrast, are code that can adapt and learn from experience, right? And so now we do have the possibility of having more automated technology that is a little more intelligent and can take over functions that previously only humans could do, right? Having that adaptation ability. Sometimes we use automation simply just to help people, not to take it over, right? And so that's our third point here, which is that having assistive technology of any sort, right? So that means, if there's something that we have to remember and it's too much and too long to be able to expect a person to keep that information in memory, having a display handy that displays the information that we need so that we don't have to remember and we can always look back to the display and access that information. That display could be a monitor in some sort of factory environment, or it might simply just be information you keep on, say, your cell phone, right? A note that you've made for yourself. That's automation in a way, right? And so we don't necessarily think of that as a form of automation off the top of our heads, but it technically is, right? What I'm doing is I am automating the task of memory, right? I'm giving it to a computer instead of me. I don't have to do it anymore. I'm going to let the information stay with this machine. And that way I can just access that information later when I need it. A predictive display is something that we might see in aviation. It helps, it displays in the windscreen from the cockpit's perspective, or on a display inside the cockpit, the future trajectory of the plane. And that helps the pilot understand when they make certain changes to their heading or based on their current airspeed, altitude, and pitch and so forth, what the plane will be doing, not just in the next couple of seconds, but also maybe in a minute down the line. And that kind of stuff might be slightly harder to predict if we would just ask a human to try to do that. There's so many different variables that can influence the plane's trajectory, several minutes from now. And so having a computer kind of perform some of these calculations and then display the results of that on a screen, so that way we can see the prediction rather than having to perform it ourselves. And lastly, well, we might simply just want to automate things because we are trying to improve our understanding of how to build these machines and that can do this, and simply just we want to try to understand it and do it because we can. So having a look here now, I've already mentioned the idea of there being levels of automation, right? So here we see Paraserm coming back in this and Sheridan also. The idea is that with we can have full or partial replacement of the human, right? So we can see that there at level 1 is essentially full human performing the task. But then we can, start introducing a little bit of help from the computer, right? So offering maybe some choices, right? So if you're in a decision-making task, one example, this is someplace where automation comes up that a lot of people don't realize, medical decision-making aids. And so there's a lot of software that doctors use in hospitals and in private practice that helps treat patients, right? So a person comes in and what do? Well, we collect a lot of demographic information about them, and we collect information about their reported symptoms. And I'll put all of that stuff into the patient software. And usually we think, well, the doctor who is an expert in pathology will understand all of that information and immediately make the call as to what sort of tests should be done to further evaluate and rule out certain diagnoses on the patient. But it might very well be the case that sometimes this process can be automated, that just by taking patient demographics and patient history and symptomology, the software simply just says, you need to run these tests right now. And then you get those test results back. And then, the software can go a little further, right? So narrowing things down and determining diagnoses. So certainly, of course, doctors remain experts in this regard, but they also do rely heavily on aids here, right? These decision-making aids will do a lot of things, right? Which is number one, think about how the real world works a little bit in a hospital setting. A doctor may be working for hours and hours and hours, and the fatigue, right, that we worry about sets in. And on top of that, they may just have dozens and dozens of patients. If you're in the emergency room, right, it's a very demanding and dynamic environment with new patients coming in constantly. So keeping track of all of the patients and all of their different symptoms and issues and specific demographic factors that might have statistical relationships to certain diagnoses, and having worked long hours and fatigue sets in, the risk of error really does increase no matter how much of an expert the doctor is. So therefore, a little bit of reliance on these decision-making aids to keep track of the information and to keep it sorted and to keep it accessible, and to ensure you don't forget something, right? That's all an excellent use of automation. And a lot of people don't realize how much automation is happening in these kinds of scenarios. Everyone wants to think that their doctor is like Dr. House on TV, right? Is a complete expert, consummate expert in their field, and they just immediately know all the answers to everything. And certainly they must definitely be experts, but we don't immediately know all the answers without the aid of some of these devices, right? So here we can see that there is some concern that, how much do we want to let machines use, and can we ever turn everything over to them and let them handle everything? Can we get to that point in medicine, for example, where we can eliminate a lot of the role of medical personnel in early stage treatment and intake of patients? And when do we need to break the glass, so to speak, and bring the human expert in to do this, right? And as automation technology gets better and better and better, then that means that maybe more and more and more these things take over for human users. One famous example of that is on the bottom right here. I know a lot of people who complain about self-checkout lanes in stores. We don't necessarily think of this as automation necessarily, right? Just making the customer do the job that was previously assigned to employees. So it's not really automation as much as it is reallocation of which human does the task. But there's still automation involved here, right? And so the fact that we have sort of an automatic scanner that reads the barcodes as you check out is certainly a lot different from how it was done decades ago when cashiers would need to manually type in codes that they read off of the uh, um, off of the merchandise, right? So, and even before that, they would just have to type in prices that were labeled on the product itself. So you'd have to have price tags on everything in the store, and cashier would manually type in prices. Then we switched to the barcodes, which you'd have to manually enter the barcodes. And then we switched to just scanners, right? And so that scanner eliminates a lot of the typing that is prone to mistakes. If a person mistypes or misreads the numbers or the price tag, there's human error there. And so by automatically scanning that, and then of course computing and calculating up the totals and calculating tax and everything else, that's all stuff that is now automated. Of course, even the bagging, there's a scale there that's designed to depending on what store you're at, designed to make sure that there's no unexpected items in the bagging area, right? And that way, they try to prevent theft. Of course, we have our classic self-driving car on the top right here. So that's another case where we think of automation in a much more obvious case, and certainly, of course, robots, right? But how far are we away from having robots? Well, to do things for us, right? That's the science fiction view of things, that we'll have servant robots that clean our houses and mow our yards and so forth, right? Well, probably not quite there yet, but we do have things like Roomba vacuums, right? And those are robots that will not just have motion cameras on them that give them a little perspective on the floor so they can navigate around, but they learn as well. And so they learn the layout of the furniture in your house, and they can get better over time of learning that layout and vacuuming your house automatically, right? But we also have assistive robotics for a lot of other reasons, right? Where people are investigating. In fact, we just had a paper come out in our lab here at UCF on assistive robots for older adults. And currently we have a couple of students who are also doing dissertations looking at these topics here. And so the idea is that for older adults, maybe we want to be able to have things like, we want to monitor things like, say, the gait of an older adult, right? That's the quality of their walking, and maybe want to predict their fall risk or health status, or detect any changes in their health status or fall risk. And in a medical setting, there are a few different kinds of tasks that you can perform. One of them is called the timed up and go task, where we just ask an older adult to stand, walk, turn around, and walk back to the chair they got up out of. And so you just watch their gait, and you monitor how long it takes them to perform the task. Can we have a in-home social robot that can take over the role of a physical therapist? So now this older adult who may have mobility issues and transportation issues doesn't have to worry about going to a physical therapist to have this test done. And we could, of course, ask the physical therapist to come to them in their home, but this is a big drain on resources, and it may be difficult to get people to everyone's homes. But if more people had some kind of a robot that could coach them through the timed up and go task, and then be able to record this information and transmit that medical data to healthcare providers, then we would have a little more information there, right? So there's some sort of robotic assistive work here for health and medical purposes. And also on the left here, we see an IV drip machine. Now, do we think of this as automation? Well, we do really, because In this case, the medicine needs to be administered at a specific dose rate, right? So I guess we're looking at 151 milliliters per hour there, shown on the display as the rate at which we're dispensing this medication. And so that's something that can be regulated automatically by a machine, and you don't have to have a human who gradually drips the medicine into the IV line themselves, right? And that's maybe how it would need to be done without this kind of automation, is that you'd have to manually administer this medicine gradually over some period of time, and that would certainly be prone to some mistakes as well. Variety of other contexts here for where and when we use automation. So as mentioned under transportation, certainly the idea of a self-driving car is an issue for that, but we already use lots of other kinds of automation in that kind of context, automotive context. So cruise control, right? That's a system that can just simply keep your car set to the speed that you set it at. But again, here's another example of a dumb system, because we as drivers can automatically, dynamically adapt our speed based on changing circumstance. So if you're out on an open highway and it's sparse traffic, maybe you can use the cruise control and you can set your car at 75 miles per hour, and it will just go at 75 miles per hour. And it will account for anything like a hill that you drive up. It'll provide a little more power to keep the car going 75, right? But if you enter into some busier traffic, and now maybe there's some cars that are going a little slower than you, and you have to be able to modulate your speed a little bit, cruise control simply cannot do that, and it will crash if you encounter slower moving traffic. So, of course, now we also have, though, slightly more intelligent cruise control systems, adaptive speed maintenance, a lane assist technology, brake assist technology. And so these things are all now a little bit smarter ways to assist drivers in performing tasks. Trains and aviation have similar technologies, right? There's autopilot in airplanes. There's similar kinds of automation in trains as well. Now with healthcare, I mentioned the medical decision-making aids and diagnostic tools, but there's certainly also assistive tools for surgery, right? Like surgical robotics and remote operation in robotics as well, or in surgery. I mentioned in military, right? Unmanned vehicles, and just in general, as we were already talking about, robots. Some specific examples of automation. So here's something that we want to think about here. Automation can perform certain tasks, right? And this is where we kind of climb the levels of automation a little bit. So using autopilot at cruise level to maintain airspeed, heading, and altitude, and so forth is one thing. Can we have automation that takes over and it will land an aircraft or take off an aircraft? Well, that's a little more challenging because there's a little more dynamic factors at play here. But certainly, as automation improves, we might be able to have planes that could simply fly themselves, and you would not need the pilot for much of anything, except other than to be there in case it fails. And this is another area where we have to really be concerned, is once we start handing over these duties to the automation, can they really just reliably perform 100% of the time without fail? And this may be true, but 100% perhaps not. So it's probably still a good idea to keep the pilot in the cockpit, even if we're not even going to do anything, right? That we're just going to let the automation run this plane from takeoff through cruise and land. You probably don't want to have this be have no pilot on board, right? Now, one thing pointing out here is that warning systems are also a form of automation, right? Because what happens here is that certainly a human pilot can detect a system has failed, and but maybe some systems fail without giving off lots of obvious information about it. And of course, sometimes because a pilot might be distracted doing other tasks, that they might not immediately notice the failure of a certain system. And so having warnings would be, which are automation, because there's some sort of way in which we automatically detect. We have sensors that automatically detect these failures. And that triggers then a distinct warning system to alert the pilot, right? So during takeoff, if you climb too quickly, you can stall the plane, right? So having something that warns of a stall, so that way the pilot can quickly adjust the pitch of the plane, lower the pitch a little bit to undo that stall in their engines. You don't want that to take too long for them to detect, right? Because if they are, what's going to happen is that if you are climbing too steeply in the engine stall and it takes you too long to detect the Zoom has detected I've raised my hand. I'm not waving. I'm trying to illustrate the pitch of a plane, right? And if it takes you too long to detect the stall, then that means you're going to keep trying to climb at that particular rate, and then you may actually lose lift, right? And if the plane loses lift because you're climbing too steeply, then what's going to happen is it will just drop right out of the sky, and we don't want that to happen, right? So what we're going to do is we want to make sure we drop the nose a little bit to undo that stall and keep a forward momentum going. Sink rate as well. So if a plane is losing altitude, then you have you could notice perhaps the altimeter dial is spinning and so forth. But simply having an automated warning that says sink rate, then that's again some assistive technology here. So for trains, on the other hand, we've obviously gone from old-fashioned steam trains to modern high-speed electric rail. And that comes with a lot of adaptive technology here, right? We have things that are assistive for the engineer driving the train, right? Cab signaling. What is cab signaling? It basically just is alerting the engineer to all of the systems in their states, as well as messages that come in from other for controllers, essentially, right? So what we need to do here is account for the fact that sometimes trains will intersect, right? So that means that maybe if you're approaching a train station, you have lots of different rail lines coming in, but eventually all those mini rail lines might converge to the same track. And this means you have to ensure that the arrival of different trains is staggered sufficiently so that you don't have two trains kind of converging their lines onto the same track at the same time where they would crash, right? And because these trains are traveling perhaps sometimes at high speed, right, with this high-speed rail that we have now, this might be something that we cannot expect the operators of the train to be able to handle, right? And so we have to have some automation here, perhaps, right? So we can do automatic train stop and so forth. But on top of that, positive train control is exactly that, right? This helps keep the kind of coordination between different trains coordinated, so that way we don't have to worry too much about trains crashing on rail. Same thing is also relevant in aviation, though, because we have air traffic controllers that ensure that planes' trajectories in the air don't overlap each other. So that way we minimize the risk of planes that might collide midair. That would be a terrible thing to happen. And that's the job of air traffic control. Of course, also their job is to coordinate takeoffs and landings, because again, you don't want planes taking off on the same runway at the same time or landing on the same runway at the same time. That's going to cause problems. So you have to coordinate all of that stuff. Now for driving, we've already mentioned the idea of having a fully self-driving car. But again, we have to worry about how effective these things can be, and can they really handle all of the dynamic driving environments that human drivers can handle. There are known cases, for example, of a self-driving car that was confused by shadows on the roadway and treated those shadows as if maybe it was an obstacle. Because how does the car know, for example, when there's an obstacle in front and needs to brake, right? Well, there are cameras, forward-facing cameras on the car that will have to be able to detect the obstacle. But how does a computer vision system via a camera detect an obstacle? Well, it has to detect lines on the roadway in front of you, right? It has to be able to detect edges of an object. So if there was a big, heavy object sitting in the middle of the roadway, like another car, it would see the edges and outline of that car and recognize that as an obstacle and then engage braking appropriately. But in this case, there were dark, heavy shadows on the roadway that had a similar shape to the outline of a vehicle, apparently, or some kind of obstacle. And so now the car suddenly just stops unexpectedly because of that shadow. Now, that kind of sudden stop, like if you're on a highway and cars are going, at a reasonable speed, like 60 miles an hour, and suddenly your autonomous car slams on the brakes and stops, that's a bad choice, right? It's going to cause an accident. And so we need to make sure that these systems are maybe a little bit, more capable of handling this kind of task, right? Of detecting obstacles without making mistakes like that. And so we might be worried about the overall long-term success of these fully autonomous vehicles, but we have, as mentioned, all of these semi-autonomous choices like cruise control, lane assist, brake assist, all of that stuff is now just assistive to the driver, but we still keep the driver in the loop. And that's the crucial thing, right? Is that in this case, the driver still makes the decisions and is only assisted by the technology. So that with lane assist, for example, a driver's attention may lapse and they might start to drift out of their lane. And so lane assist just gives you a little bump back to the center of your lane. Same with brake assist. You could be stopping, but if you are not applying sufficient brake pressure, then the car is just going to help out and ensure that you brake correctly and don't crash. So let's talk about some trade-offs here. We've kind of already skirted around these issues here. I can't make the raise hand thing go away. I don't, don't worry about it. Talk about automation, right? That was an automation failure, I guess, at that point, right? Automatic gesture detection here has activated something I didn't really want. So the goal, as noted, our goals here and theoretical benefits would be to eliminate human errors, to maybe in some cases where people have to be engaged in multitasking, right? So a lot of times when we are engaged in any kind of complex task, we're doing many things at once. Driving is a pretty typical example of that, right? Because you have to do lane maintenance and speed maintenance while monitoring hazards and so forth. And so if we can kind of help out the user by doing a little bit of lane maintenance and speed maintenance automatically, that frees up our user to do other tasks, right? And so maybe the decision-making tasks like what is my route and where am I going and when do I need to turn and so forth. Those are the higher level choices that our driver needs to make, and we want to free them up so that they can focus on those higher level tasks and let the car kind of do some of the more lower level stuff. So as noted, we can have plenty of failures, so we have to worry about that. And then there's another crucial issue here. So what happens if like I imagined a scenario a couple of slides back about the possibility of having automated planes that can handle the entire task of flight from takeoff into cruise and then land without a pilot ever needing to lift a finger. And that certainly would be an interesting thing, though, of course, what we need to think about here are two things, which is number one, what happens if the automation fails suddenly, mid-flight, mid-takeoff even, or mid-landing? What you need to have is you need to have a human operator who can intervene at that point. So we don't want to take the pilot out of the cockpit. We want to keep them there so that they can jump in and intervene at the exact moment this failure occurs, which of course means that we need to make sure that operator, in this case a pilot, is continuously informed about the state of the automation and what it's doing and when it fails. So that way, in the case of a failure, the pilot knows immediately the failure has occurred, but the pilot also knows what kind of failure it is, and therefore what kind of intervention is required. And then also they need to know what's the current task that the plane is doing, right? If the pilot has no idea that the plane is currently on approach to an airport and is in the process of lining up for a landing, and then the automation fails, and then the pilot needs to, intervene, but they don't know that we're trying to land the plane at this point, then maybe the pilot will do the wrong thing because the pilot's simply just not in the loop, right? So what we need to do here is worry about what's called situation awareness. And when the technology is performing the task for the user, that means the user has the tendency to potentially get distracted with other non-essential tasks that might then eliminate or reduce their situation awareness. They simply just don't know what's going on around them. And then suddenly when they're called upon to do a task, they don't know what to do because they have no idea what's going on. So this is where I threw in our Homer example here. He's in a self-driving car, if it's not quite obvious there, but he's gotten involved in all kinds of other things since he doesn't have to worry about driving anymore, right? He's watching a cooking show and doing some baking, and he's got a phone fax machine in there and so forth. And of course, also thinking about skill, right? What happens if we have self-driving cars or self-flying planes and we don't ever have to do these tasks for months and months or years at a time, and then suddenly it breaks, and then I got to start figuring out how to fly the plane or drive, but it's been so long that maybe I forgot. My skills have deteriorated some. So we have to worry about these kinds of issues as well. So maintaining skill, maintaining situation awareness so that we can still have human intervention as needed is pretty appropriate. Here's another thing we want to think about too when it comes to using automation. Now, this is a slightly dated list. This comes from quite a long time ago. Paul Fitts was another kind of legendary human factors psychologist. And he proposed this idea of how to think about, again, the difference between human intelligence and machine intelligence, which is that humans tend to be very good at being adaptable and flexible and are good at detecting patterns, whereas machines are much more rigid and perform the kinds of activities that we program to do in a very non-adaptive, fixed, repetitive way. And so when we look at this list, for example, the second one down, the human excels in sensitivity to a wide variety of stimuli, but machines excel in routine, repetitive, high precision activities, right? And so similar down to the bottom of the list, one of them is profiting from experience and altering the course of action versus a machine being insensitive to extraneous factors, right? And that's the example I gave earlier about the unmanned ground vehicle that might not realize when it hits muddy ground and loses traction, and it just continues to plow ahead without any sensitivity to change in what's going on here. But as I said, there's a slight, so this is a useful list, right? This is a useful list to get us started. It's a classic thing in human factors to think about allocation of function and which tasks do we allocate to machines and which tasks do we allocate to human user. But that essence is good, but where this list begins to become dated is the fact that it does not really account for changes and improvements in automation in recent years, right, with machine learning and artificial intelligence. So once we start using automation, we also want to think about doing a task analysis for our user here. So something to think about is in a task that a person has to perform, we can break that down in terms of 4 cognitive stages that the user is faced with, right? So let's think about a task that I've already been talking about, lane maintenance with driving. And so what I have to do is I have to first have sensory processing, which means in this case, I need to detect, sorry, my dog is barking now. I need to detect when I have deviated within my lane, right? That when I'm starting to drift to the left or to the right. And then once I do that, I have to then take that information in and work on that information. I have to operate on it. I have to think about it and remember what it is I'm trying to do. And I have to then make a decision, right? And so then I have to decide, well, what is my decision? I have to steer left because I've drifted to the right, or conversely, I have to steer right because I've drifted left. And then I have to implement this action, which means I need to actually grab a hold of the steering wheel and turn it one way or another by the sufficient amount, right? Not oversteer or not understeer, right? I need to correct my drift just so, right? So this means that there's a possibility of error at every step along the way here, right? One example would be that I uh, fail to detect my lane deviation, right? That I simply just don't see it for whatever reason. Maybe visibility is poor because of rain or nighttime driving conditions, or maybe simply just because I don't check that information with my eyes sufficiently often, right? My eyes are elsewhere, looking at something else. So we can automate stage one of the human sensory processing system, right? I can help with detection of the lane deviation, right? By having these cameras, as I mentioned, on the car that can see the roadway and detect the position of the car and provide that kind of warning alert, warning lane deviation, right? So now this is a sensory assistance that's the automation is helping with here. And then there's the analysis side of things, right? So that means that I have to analyze this sensory information to determine which direction am I drifting, and am I drifting too far, or is it time yet in order to make a correction, or can I just keep doing what I'm doing? Again, making the decision to correct comes in step 3. So again, we have to now determine, can I have the system do this for me, right? Can the system be smart enough to make the decision, or do we need to let the driver do that? And then even implementing that. So again, if we have something like lane assist, then not only does lane assist help make the decision, but it also actually helps steer the car back to the center of the roadway, right? But at each one of these stages, we can have the possibility for automation to do the job for us here. So our next concern is whether the automation is reliable. Does it really work all the time? And so we've already been skirting around this issue that that it can make mistakes, right? Sometimes it can simply just fail and shut down for whatever reason. Sometimes because computers are not necessarily based on adaptive machine learning algorithms, that they simply just repeat their actions in a way described on point 3 as being dumb and dutiful, right? Dumb meaning it doesn't know anything, it doesn't adapt to circumstance, and it's dutiful because it will do exactly whatever you program it to do, regardless of whether that outcome is desirable, because in many cases the computer does not have the ability to assess whether we are achieving a desired goal, because the computer may not even know anything about goals, right? And understand that. So therefore, it's the human that has to make sure that these things are working according to how we really want them to work. So we have to worry about reliability. Does the system break? Do we worry about the flexibility of the system? That's point 2. Does it really can it really function in multiple different kinds of contexts? Do we sometimes ask automation to do things that it's not meant to do, right? As that's another thing we might be concerned about here, is expecting. This happens a lot with people who have those lane assist and brake assist features on their car, is they might try to treat that as a self-driving car that could just take over the act of driving. And so then they just turn all of those features on, and then they lay back and go to sleep and then crash. So that's a situation where a person is using the automation in a situation that it was not really designed to do that necessarily. Sometimes automation surprises people. So again, if a person does not understand what the automation does, then they might have certain expectations and false expectations about what it's going to do. And that can lead to bad things happening, or simply just outcomes that confuse operators. And if the operator becomes confused because the automation is doing something that they don't understand and so forth, this might actually lead to abandonment of the automation. And so that's again related to the issue of technology use and acceptance, is that sometimes if people think that, hey, I don't really understand what this technology does, and it seems to sometimes behave in ways that don't make any sense, therefore I don't trust it and I'm not going to use it, right? And then also some people just have negative attitudes. And so we've mentioned a little bit here and there about differences in cultural perspectives. And that's an important issue, right? People are going to have, based on their age, based on their culture, based on any number of other personality and individual differences, perhaps negative perceptions of technology. And therefore, sometimes people will say, I don't want to have a machine do that for me, because I want to do it myself, right? And that's just an attitude that people will have. And that certainly is something that also needs to be kept in mind. And sometimes people can have these attitudes even when it's not really beneficial for them, because they may insist on doing things for themselves. This results in what we're going to call possibly complacency, right? So complacency occurs when we possibly our levels of trust in the technology are somewhat misplaced, and maybe we overtrust the technology. So we need to think about trust a little bit here. And so we want trust to be something related to the reliability of the technology, right? So you might think, for example, if you have an old car and sometimes it starts in the morning when you try to get up and go to school or go to work, and sometimes it doesn't, then it's not reliable, and therefore you don't necessarily trust it. So you're like always a little stressed out because you don't trust your car, and sometimes you're not going to be able to get to work or school on time because you had trouble with your car. So this is the kind of trust we're talking about here. Do I trust these machines to do what I expect them to do when I want them to do it, right? So I trust my car to start. Do I trust the features, the assistive features and automated features on the car to work when I'm driving? Do I trust my computer to not crash and lose all of my files and data, right? These are the kinds of things that we have to consider about humans trusting technology. So we can have examples of mistrust, right? Where we simply just do not trust the technology. And that can be valid, right? It can be sometimes valid to mistrust the technology if it is in fact not reliable. And so if you do have a car that doesn't start, you don't trust it. So we will call that mistrust. But that's a valid thing to have, perhaps. But then there's the corollary to that, which is distrust. And distrust is essentially sometimes a situation where a person's thoughts on the matter might not be correct. So it might be the case that the technology is more reliable than the person perceives it to be. And so they do not trust it, even though they really could and ought to trust the technology. So we're going to call that distrust. And this is an example here of some poorly calibrated trust. And the other example is overtrust that I was talking about with complacency, right? So the person who thinks that their car is a self-driving car just because it has cruise control and lane assist and brake assist is likely to be over-trusting, and they might expect the car to do more than it really can, and that leads to complacency. That means they think that they can just let the technology do all these things for them, and they don't have to pay much attention to it anymore, right? And now there's some degree of over-reliance or over-trust on the technology, and that can mean possible mistakes. And so, of course, other examples here related to some of the disadvantages of automation that we've talked about already: the loss of situation awareness, some skill loss, or maybe just slower in detecting certain important states here. So we can see the distrust and overtrust relationship on this graph. So on the x-axis would represent the actual reliability of a system, and we have now the person's, on the y-axis, perception of the reliability. And so that, that line there that kind of cuts the diagonal would essentially have a slope of 1 and an intercept of 0 would represent a properly calibrated trust system, where increases and decreases in the actual reliability would result in consistent proportional increases and decreases in the perceived reliability of the system. And therefore, the person would trust the system appropriately. A low reliability system would not be trusted, but a high reliability system would be trusted. But the problem is that people's perceptions of reality are not always correct, right? And so we can have distrust when the perceived reliability is less than the actual reliability, right? And likewise, overtrust is when the perceived reliability is greater than the actual reliability of the system. And so what we now want to think about here is what determines perceived reliability. This is, again, the human factor. Why do people have differences in their perception of the reliability of a system so that they're not perfectly accurate here, right? So that's a huge area of research that I don't really have a little extra detail in here necessarily, but the idea is those are some of those individual differences and past experiences that people have about technology can certainly influence their perception of it here. Here's a few basic principles about automation that we want to ensure now that we've learned a few lessons about when automation may be unreliable and when there might be a misperception of trust and when it might be not best to use it because it's a job better suited for a human. So we have to think about these 5 key principles here. Always keep our human user in the loop so that way they are able to intervene as needed. We need to maintain training to avoid that skill loss. We need to allocate function appropriately, whether we use fits list or a much more updated list for improved automation. And we want to ensure that our automation is as flexible and adaptive as it can be, but also we need to account for user trust, right? And what are the factors that influence a person's perception of the technology so we can understand their trust levels and their tendency to complacence. So we can explain a little bit here more about the psychology side of trust and perception of reliability. And this is where we talk about the technology acceptance model that I alluded to at the beginning of the notes here. So what we want to do here is we want to predict something called intention to use. So if there is a new technology, we want to know if people are going to be willing to use it because we can invent all kinds of things that might in fact work, but depending on how people perceive these technologies, they may or may not elect to use those technologies. And so intention to use is an important thing. If nobody's going to use it, then we need to understand why so we can address that. And then even after that, there's the concept of disuse, right? So somebody might adopt a new technology, but then after they start using it, they might discover for various reasons that they don't want to use it anymore. And so they abandon it. And so that's called disuse. And we want to understand some of the factors that predict this. So the classic technology acceptance model accounts for, at least with intention to use, 2 concepts, usefulness and ease of use, right? So first one maybe is somewhat self-explanatory. In order to adopt a technology, it has to do something that I think I want done, right? So one of the areas where we've studied this in recent years in our lab has been smartwatches and fitness devices, wearable fitness technology, right? These things will track your steps and your heart rate and sleep cycles and a variety of other biomarkers and provide you with a lot of information about your health status. And so the question is that will people adopt and use this technology? Well, they will only if they perceive that there is some utility to having this information. So some people think, yeah, I want this information about myself. And so they say, I'm going to go right out and I'm going to buy one of these things. But other people say, I don't really see why I need to know that. And therefore, if they have no desire or a sense that they ought to know these kinds of things, then maybe they don't buy it. But related to that perceived usefulness is not whether they think they ought to have the information, but whether they trust the information. So maybe I want to have more health-related information, but I don't think that these wearable technologies are going to give me accurate information. And so then I think, well, if I don't think that they're going to give me accurate information, then I don't perceive them as useful because inaccurate health information is not useful. So that could also be a barrier to adoption here. But then there's the ease of use issue. And this is especially where human factors can come into the picture here because a human needs to use the technology and be able to understand how to use the technology. And so there can be all kinds of things that come with some of these wearable fitness technologies. For example, out of the box, I have to get this thing set up. I have to pair the Bluetooth of the device with my smartphone, and I have to install the app and set up an account and do all the things on the app, and then get all of this coordinated. And then sometimes what happens is that maybe my device unpairs from the app and I have to repair it. And so then, so all of these things start to factor into, is this all easy to use? How easy was the original Bluetooth pairing procedure? How easy is it to install the app? How easy is it to use the app? Does the system sometimes break down and lose its connection, right? So because of all of these issues, someone may perceive that, well, I really wanted this technology. I thought it was useful, but I find it not easy to use, right? It's confusing and so forth. So then there might in fact be a barrier to use here because of the issue of how much complexity is involved. Now, in some recent years, the technology acceptance model has been extended to try to account for a few more social psychology influences in our tendencies to adopt technology. So what does everyone else do? Right? This is called conformity in social psychology. And there's a lot of classic research that shows that, yes, in fact, despite everyone's claims to want to be their own person and an individual, we follow along with lots of fads and we conform to others. And so when the wearable fitness technology came out, it caught on quickly because it became a little bit of a fad, right? And so lots of people will adopt it. But the question is, do they keep using it, right? Lots of people adopt these things and they use them for a few months, and then it ends up in your in a drawer somewhere for until you decide to toss it, right? And then autonomy is another issue here as well. This also relates to our kind of social perception of the technology, right? So sometimes, I make the choice that I want to go buy one of these wearable fitness technologies, so I get to make the choice. But there could be other technologies, like what if my employer wants to track my health? Because maybe that affects how much they want to pay for my health insurance. And so if they force me to wear these things because they want to detect if I'm living a healthy lifestyle, and if I'm living a healthy lifestyle, maybe they'll charge me less for my health insurance than if I'm not, then maybe I feel that I don't really have a choice in this matter. And this feels very invasive. And now I have a very negative impression of the technology, right? So my choice in the matter is very important here. And then there's also just things like social status, right? That there are some kinds of technologies like a lot of the newer electric vehicles that have a lot of automation features in them are seen as status symbols, right? A lot of them are fairly expensive cars, and so driving them around with the company badge on it and so forth maybe is a way of trying to show off some degree of social status, and so that can also influence people's tendency to adopt these technologies. Is there some sort of perceived social benefit to having and using this technology? All right, well, now we are done with our revised automation notes.